Just real quickly, my name is Alex Mitchell. I'm a marketing communications manager with Lighthouse. You may notice I'm battling a slight cold that my kids recently brought home from daycare. So please bear with me and rest assured I won't be our primary speaker today. But real quickly, I'm also pleased to welcome our partners from HC1. While we'll be covering best practices on hiring and retention, they're going to be spending a bit of time near the end of the webinar today, showcasing a solution that can help to optimize your workforce and make hiring decisions based on hard data. Now, before we dive into some of our housekeeping items today, I'd like to quickly introduce our expert speakers. First, we have Joe Kessler, Director of Recruiting and Staffing for Lighthouse. Joe has over 10 years of experience in healthcare recruiting and research, and he currently leads the recruiting arm of Lighthouse Lab Services. Together with the recruiting team at Lighthouse, he has helped hundreds of laboratories across the country hire and retain thousands of scientists, managers, and laboratory directors. Joining Joe from Lighthouse and our recruiting team is Patty Hess, a senior account manager. Patty is an accomplished account manager with more than 10 years of experience in healthcare staffing and account management. Throughout her career, she's built a proven track record leading strategic initiatives, optimizing operational efficiency, and consistently delivering exceptional client satisfaction. Her expertise lies in recruiting top-tier laboratory personnel and ensuring regulatory compliance within the healthcare setting. And then finally, joining us from HC1, we have John Moyer, Senior Product Director. John has progressively driven services and products at HC1 from the start to finish, along with a dedicated team. Now as Senior Product Director, John's responsibilities focus on product planning and execution throughout the product lifecycle. John holds a BA in biology and chemistry and an MS in biology and has a 25-year background in healthcare. His areas of expertise encompass clinical testing, laboratory operations, data integrations, CRM, workflow development, and patient care journey. His experience as a lab scientist and his role in the clinical workflow development elevate John's insights into what labs struggle with in today's market. So just again, I'd like to say thank you to each of our speakers for joining us today. Touch on a few housekeeping items here. For those of you who joined us in the past, this won't be anything new. But if you are having any slowdown during this presentation, close any apps you might have running in the background. This webinar will be recorded. It's going to be sent out to everyone who registered here today after, usually around 4 p.m. The recording's ready. So look for that in the inbox that you registered under this event too. If you have any questions, you can go ahead and pop those in the Q&A throughout this webinar, and we're going to try to address those best we can as time allows at the end. If we see those in the Q&A section, we'll go ahead and publish those. If it's a question you'd like to see answered, you can upvote it and we'll try to respond to the most popular questions first. And we're also going to run polls during the webinar. These are strictly informal, just to give you something to engage with and get a little bit of a better sense of our audience and some of the struggles that they're dealing with. If you see that pop up and you don't want to respond, go ahead and just click the X and you can move on. And quickly, I want to tell you a little bit about Lighthouse Lab Services recruiting arm. We provide a host of services across all sectors of the laboratory industry, but specifically with our recruiting, we specialize exclusively in the medical laboratory industry, filling permanent and travel positions for roles at all levels across the country. We have industry-leading retention. Lighthouse is typically our client's first and last choice to assist in finding and retaining great employees. And best of all, we offer risk-free recruiting and staffing with a 90-day guarantee that any candidates we place in your laboratory will work out or will work to find you a solution and a replacement. And now I just want to quickly turn things over to Joe. We're going to have these offers throughout the webinar. If you're interested in speaking with us at Lighthouse about landing your next role or potentially for recruiting to help staff your laboratory, go ahead and use that form. You can go ahead and open it now too and fill it out later. We'll receive your interest and get in touch with you for a complimentary consultation. And with that, I'm going to hand things over to Joe to talk about our survey and the results.
All right. Thank you, Alex. Appreciate the intro. Thank you for joining us here today. Good morning, good afternoon for those of you on the East Coast. Want to start by saying that this is the third year we've conducted this wage and morale survey. Lighthouse has really become one of the leading industry kind of trend analysts for laboratory wage and morale. And the reason that we do this each year is to just keep folks current on current levels of wages, staffing, and overall satisfaction among lab professionals. We know for many years there's been a pervasive shortage in the industry, and many labs across the country are wondering what they can do to help address that within their own setting, within their own workspace, and for their staff. Couple things we're going to talk about today. We're going to go in depth on each aspect of our survey results, but I want to highlight a couple of things right off the bat this year. For the first time, our results actually show a significant jump in overall reported satisfaction in the lab. 52% of our respondents are noting moderate or extreme satisfaction in their current role. That's up from 44% in 2023, and from 2022 to 2023, that was largely flat. Another great item to highlight today is the majority of our respondents received salary increases in 2024. We're going to talk more about that, break things down a little bit more for you. Another quick highlight as well is that staffing levels and burnout do remain significant. Keeping things in line with some of our past results. Many individuals again indicated that they feel like their lab is understaffed, though as we'll talk about, that has improved somewhat from COVID time period. The majority of our respondents no longer report feeling overworked, but 48% are still noting that they feel their workload doesn't permit them to do the best possible work that they can do. Again, we're going to talk about all this in more detail as we dive into the numbers here. Sorry about that. So first, I want to talk about the experience and education pool of the folks that we surveyed as part of this wage and morale survey. Our respondents, and we had over 1,000 of them, generally indicated 40%, a plurality of them indicated that they have 21 or more years of experience in the lab. So as you can kind of see from the graph outlay here, many folks in the lab who responded have been there for over 20 years. We've got about 16.5% of our respondents as recent hires. And then amongst those respondents today, 75% of them are in a high complexity setting. This is more to build the context for the conversations that we're going to have. So as you kind of lean in and hear some more of these results, just know that we have a sampling from across all experience levels, but that a large chunk of our respondents are more experienced. Now, as many of you may know, that is also largely because in the laboratory industry, we have a rapidly aging workforce. That has been some of the reason behind the shortages that we're going to explore. But ultimately, again, we have an experienced pool of respondents. It is weighted more towards those folks as we discuss these numbers. I'll also talk about the demographics breakdown of our respondents first. By gender, most of our respondents were female, 80%, and the remaining 19% male. We had 1% who chose not to disclose or identify as non-binary. Amongst our respondents' race and ethnicity breakdown, 68%, almost 70% are white and Caucasian, 9% Black, African American, 8% APAC, Asian Pacific Islander, another 8% Latino Hispanic, and the remainder either multiracial, Native or Alaskan, or chose not to disclose. And then among the breakdown for the respondents on position, again, I'm just, not to speak too much about just what's on the slide, but the majority of our respondents are bench level technologists and technicians. The remaining respondents are either managers in a laboratory director position or in frontline staff or ancillary staff roles, admin support, and field service engineering. So again, to the top line, to the headline of, I think, I feel one of the biggest takeaways from today's survey is that staffing issues have improved since the worst that we saw during the COVID period, but they are still persisting. 59% of our respondents said that their lab is moderately or significantly understaffed. That's an improvement over last year, where over 2/3 of respondents reported feeling that their lab was understaffed. Another interesting thing to take a look at here is in kind of breaking down, okay, so amongst those who feel that their lab is understaffed, what is the job satisfaction? And you'll note that the majority of respondents identified themselves as either neutral or unsatisfied in their roles amongst those who reported feeling understaffed. So it's probably not a huge surprise that if your lab is not properly staffed, your staff is very unlikely to identify as extremely satisfied in their role. However, at least surprising to me, 34% of respondents identified themselves as moderately satisfied in their position, even though they were understaffed in their lab. And I think that is a reflection of just what has become the new normal in the laboratory, testing space. We have seen trends towards understaffing for 20 years in laboratory testing. And so those who have entered the field any time within the last 20 years have probably known at least a period where their labs were not optimally staffed. And so although it's very unlikely that your staff is going to report being extremely satisfied if they are feeling as though the operation is understaffed, it does not necessarily need to be a death knell for morale in your organization. We're going to talk more about ways that even labs that are slightly understaffed can do more to help support their employees and support morale in the workplace, because it is not impossible to have good morale and high job satisfaction in a lab that is not optimally staffed. One other thing that I want to note that was interesting to me is that the job satisfaction or job morale for as compared to experience, one of the results that we saw or that we identified that was surprising or worth noting is that among professionals with 5 or fewer years of experience, 31% reported dissatisfaction with their role. That's a slight improvement, although probably statistically more or less even from 2023 to 2024. We find that among professionals who are more experienced, 21 years or more of experience, they reported the highest levels of satisfaction. Now, I believe there are some reasons for this that we're going to discuss a little bit later, but one of the biggest ones for my money as I look at this is that folks with more experience in the lab tend to also be in management positions, meaning that they have had a level of investment and career growth that our younger techs have not experienced yet. And by younger, I should say, I mean less experienced. So folks who've been in those roles for 5 or less years may not have had the same advancement opportunities or training made available to them in their short career. It's definitely an area for potential emphasis if your lab is looking for ways to cultivate the next generation of laboratory professionals, to take a look at what can be done for those younger techs. And I think we're going to touch upon that a little bit later when we discuss ways that your lab can look to boost morale in the coming months and year before hopefully we survey again in the same period in 2025. A couple quick things to note again about the survey respondents. 95% of our respondents were permanent employees, and the majority, 71%, work on the first shift. Not unsurprising, amongst those who worked second or third shift, there was an average reported shift differential of $3.41. Maybe worth noting that if you're working in a hospital setting, we will see that that shift differentials are an important aspect of compensation to ensuring that you have good retention, and the ability, frankly, to hire effectively on your second and third shift. We have a question here that I just want to drop a quick note on, from Christine Nielsen. Thank you, Christine, for asking. I'm trying to assess if the change from 52% versus 48% of all respondents reporting overworked feelings from one year to the next is statistically relevant. I do want to note that this survey is not a scientific survey. There are certain variables that are not controlled for here. However, we do feel like this provides a very good snapshot and sort of relevant data points for discussion. A change of 52% to 48% year to year is not a massive shift, and it's something to take note of, something to be aware of, that it's fairly flat, if not a downtick slightly. But when we talk about statistical relevance, I do just want to flag that these numbers are helpful. They're data points, but we're not able to assign specific p-values or statistic relevance to any one of these numbers. I do think, nonetheless, that these are good for shedding light on some very broad trends in the lab. I think this is probably one of the most salient points we're going to talk about today, which is really the salary breakdown by position. So I want to provide these top line numbers from 2024 to 2023 because, again, these self-reported numbers do reflect general wage increases from 2023 to 2024. We would expect to see that each year. Cost of living goes up. Obviously, we know inflation is something top of mind for people. The reported salaries across all positions have increased in the lab. I want to dive into a specific aspect of that in a second, but I do want to just note that you'll notice some of the biggest jumps here are as a percentage, are in the tech positions, are in the technician and technologist roles. That's important because these are our frontline staff. These are our bench testing personnel doing many of your lab tests. They are kind of the lifeblood of the laboratory. And so making sure that your techs are being compensated in line with both your state, local, and national averages is going to go a long way to ensuring that your hiring and retention remains competitive. To that end, I do want to talk about a couple of caveats with those numbers. So when we report these numbers out, we ask folks for their location, where they work. And I think that's very helpful because when we look at national averages, which was the last slide, we lose sight of high cost of living states that may skew the numbers to the upside. So we could really spend all day carving up the map and saying, certain metro areas, certain geographies, certain places are a little bit, or have higher costs of living, are going to result in higher wages for folks. But I think backing out and just looking at saying, like, what are the three states that have, generally speaking, the highest cost of living in the United States, where we also had a relevant number of respondents? That's California, Hawaii, and New York. And you'll see when we pull those folks out of the overall averages, it does bring down the average compensation level. So whereas our national, if we include all respondents, manager salary, for example, is $101,000 a year, if we look at just those high cost states of California, Hawaii, and New York, we see an average closer to 141,000. Of course, if you work in California, for example, your number is going to be even higher. once pull those numbers out, you'll see, for example, that the manager average nationwide drops to 97,000. Again, removing those high cost of living states. Michelle had a question about Hawaii's cost of living. It's all sort of variable. Hawaii has a very high cost of living, as you're aware, if you live there or if you've experienced any staffing there. The experience that I have in staffing for the state of Hawaii, the pay rates aren't necessarily as high in keeping with the cost of living in Hawaii as you would expect. However, they do exceed the national averages in almost all cases. So again, when I'm trying to help, trying to pull or tease out some numbers that could skew things to the upside, I do want to take a look at Hawaii because almost all of our respondents from the state of Hawaii report above average wages in these categories compared to the national average. And again, the goal here is to pull out statistical outliers to help assess where you should be thinking about compensation for your lab techs if you live in one of these non-high cost geographies. So looking at these again, once we pull out those high cost of living states, we see some changes across the board, some general lowering of the comp levels. CLIA lab director, we see compensated at $218,000 without California, Hawaii, and New York taken into consideration. Administrative lab director being compensated at around 136,000, managers at 97,000, technologists at 77,000, and technicians at 59,000. I do want to pause here for a second because, again, as Alex introed me at the start of this call, I do lead our recruiting and staffing division here at Lighthouse, and I have the opportunity to work with at any given time, dozens of labs across the country and hundreds in my career, if not thousands, who are looking at this question of, is my compensation competitive with what's out there? And I think one of the biggest changes I've seen in my career and my time doing this work is that there's really a marked change pre and post COVID. My feeling or my observation rather, pre and post COVID, is that labs are having a hard time sometimes wrapping their mind around the new standard for compensation, particularly at the bench level. It used to be kind of common to see labs paying their technologists, for example, $25 to $30 an hour, even within the last 5-6 years. That we're finding increasingly is no longer the acceptable compensation level for many geographies. We are seeing wages there on the technologist side closer to $35 to $40 an hour, particularly among techs with 3 to 5+ years of experience. Technicians on the same side will see a similar rate of change. Whereas it may have been common within the recent past to pay in the low 20s per hour for folks with an MLT, an associate's degree and an MLT, we are seeing those wages creep up closer to an annual salary figure of 60,000, which breaks down to an hourly rate of $27 to $30 an hour. Now, there's a lot that goes into that. There's shift differentials. There's other aspects of that compensation. There's overtime. But the point is that the paradigm is changing, and with as much inflation as we have seen in the last couple of years, it has turned into a scenario where laboratories really have to ask themselves if they are still competitive with their salaries, with their wages that they're paying their laboratory technicians. Because, and we're going to talk about this, the lab is the people. The lab is the folks performing the testing, and so making sure that your salary and wage levels are dialed in is going to make your satisfaction levels, your morale levels in the lab higher and more resilient to issues like understaffing or other changes in healthcare. We've got a couple questions, specifically about, further teasing out these numbers either for supervisors versus managers or data state by state. I'll let Alex kind of address that as far as the ability to tease that out and share it with you. But we certainly do have the location data of all respondents. And so we will we'll make available whatever is able to be easily shared. And again, I'm sure Alex can address that either at the end of this call or subsequently in follow up. Before I move on to introducing my colleague Patty Hess and talking a little bit about specifically CLIA Lab Director data, I do want to flag one thing that came out of this survey that we have touched on in the past, and we will continue to flag for folks that are decision makers in the lab, which is the gender wage gap. One of the things that we noticed, again, in this non-scientific survey is that a 23% pay disparity showed up across all positions, women compared to men. So what that means is basically amongst our respondents across all job categories, women reported being paid on average 23% less than their male counterparts. This backs up data that we see or that has been reported publicly for many, many years across many industries. But of course, Forbes has reported that women earn on average 84% of what their male counterparts make, and that this disparity grows among women of color, including African American, Black women, Hispanics, compared to white non-Hispanic men. So if you are in a position to analyze this number in your own labs, I would encourage that. I would encourage you to look to make sure that your gender and wage comparison is holding up, is fair and equitable in your own laboratories, because we've seen that laboratories that offer pay transparency or are committed to equitable salary levels generally report higher levels of satisfaction as a rule. We had an interesting survey response that I wanted to share with you. We didn't include a whole lot of individual responses here, but it was very illuminating for us. And this was a survey respondent in this year's survey who obtained the specialty in their field and found out a week before the results came back that a specialist position was given to a male colleague who wouldn't qualify for the position for 5 years. And of course, this is anecdotal, but it is something, again, to keep in mind if you're in HR, if you're in a directorial position within your lab, to be thinking about these questions, because it is something that has come up time and time again in our surveys, is this sense of gender inequity or pay gap in reported numbers. I do want to introduce here for a moment my colleague, Patty Hess. Patty is our Senior National Account Manager for our Laboratory Director Services. Patty is really the specialist, and I truly believe one of the nation's foremost experts in CLIA Lab Director, trends, services, and compliance. Patty's going to share a little bit about our results for CLIA Lab Director, as well as just tell you a little bit about why Lighthouse knows this, how we work with CLIA Lab Directors in the everyday. So Patty, turning things over to you now.
Thanks, Joe. So I'll tell you just a little bit about our program here before we get into the takeaways from the results from the survey. Here at Lighthouse, we do have a large database of director level candidates all across the U.S. that we do place in part-time laboratories for our clients. We have over 150 plus clients across the U.S. Our services do provide them with candidates that meet state, federal, and any accrediting body regulations needed for the director program. They do remain 1099 contractors of Lighthouse Lab Services, but they are dedicated to your CLIA needs. This service does operate on a contingent basis, meaning you don't incur any charges until you've had an opportunity to review, discuss, have initial interviews with candidates, ensuring that you do find the best fit for your laboratory. Now we can just kind of go into our takeaways. Again, the data collected was from 37 PhD level directors. 30 of those did happen to share their compensation with us. So on average, the reported salary for CLIA directors. This is $224,000 per year. This is going to be based potentially probably on your full-time directorships, not on your part-time directorships, as we see that 45,000 of those, or rather $45,000 is the average amount that we see directors receiving from consulting work in the year in 2023. This is 35% of our directors are working at multiple labs that they're employed as either 1099 contractors or W-2 employees. About 98% of them are actively serving in CLIA designated roles. This can be lab directorships, CLIA clinical consultant roles, technical supervisor, and or technical consultant roles. And we do service all of those for our clients. So we did ask or provide some tips for our directors. We just asked that, hey, if you're trying to look for a good role out there, be mindful of some things that you may be to do to, provide you with a good opportunity. Spend time on your CV. Make sure you include some of your experience, highlight some of your specific roles that you're applying for. When you get on those initial calls with clients, make sure that you're asking about staff if they're qualified, because you want to be able to say, hey, you need additional people for your amount of volume for your testing lines, so that you have a sufficient or adequate amount of personnel to be in the laboratory. Be prepared for any type of questions that clients may ask you about leadership or your communication style. They really want you to have that good communication with other staff, so that you can come on board and address any concerns that they may have, or implement any other new operational improvements. For our full-time directorships, we do ask that be mindful of your past experiences. Clients are going to want to know what your leadership style is like, what your roles in leadership consist of. What have you brought to the industry? What are your future insights for the industry, and how you'll be able to apply those for future guidance of the company. These are all just tidbits that we've heard from all of our candidates that we just talked to. I'm on calls with consultants, 1099 contractors, and clients every day, all day, what it seems like. And so they do share some of this information with us. So it's my privilege to be able to share that with clients and consultants all around, so that you'll be able to be prepared for any upcoming scenarios that come your way or opportunities that come your way.
Yeah, absolutely. I think, one thing to understand about Patty is that she is constantly working with dozens of laboratories each and every day, dozens of part-time lab directors each and every day. So if you're a lab who's looking to potentially think about moving to a part-time model for your lab director services, Patty's a great resource for that. If you're a lab director who is interested in taking on consulting work, equally, Lighthouse is here for you to talk about that. And part of the reason we do this wage and comp survey, is to let labs know what's the growing rate. We hear that question all the time. What is a lab director going to cost me? And I think, whether you're doing a full-time model, like Patty mentioned, and you're looking at somebody who's probably going to be requiring somewhere around $225,000, even $250,000 a year, we do have part-time options. We do have consulting options for folks that want to take a look at that. So we'll go ahead and move on from CLIA lab directors to just talk now a little bit about retention, because retention is something that we talk about in this survey. The goal of the survey is to understand how people are feeling about their current work, because, from my perspective as somebody who does recruiting and staffing every day, I always tell people it is so much less expensive to retain your staff than to hire somebody new. You might have heard this stat before, but when you have a position either unfilled in your lab or you need to rehire in your lab, it is anywhere from 3 to 8 times more expensive to do that than, again, to implement some simple measures to make sure that your lab is retaining staff and actively working towards being a place that provides high levels of job satisfaction to not just your bench level techs and admins, but even your managers and supervisors. So want to talk about a few of those tips right now. And again, this is partially based on survey results, but this is also partially based on our 20 years of experience in helping labs to understand these questions. But for improving frontline retention, the biggest thing for me is this idea of whatever you permit in your lab, you promote. What that basically means is if you allow staff to cut corners, if you don't address personality conflicts or other types of conflicts in your lab, if you allow those things to fester, it is going to drive away your best staff, and it is going to retain those staff members who might be responsible for some of that corner cutting. The culture of the lab is what you ultimately decide to make it. There is no lab. There's lab equipment, there's samples, but there is no lab in the absence of organizational culture and management. And so I really want to encourage those of you on the call who are managers, or those of you who are even directors or administration, to really work with your frontline managers, with your supervisors, with your team leads to make sure that you are doing really three things. And that is looking for opportunities for continuous improvement, whether that's providing CE credits or stipends for folks that take care of that stuff, to make sure that you are always emphasizing safe conditions. And I don't just mean safe from the standpoint of what CLIA requires for a safe laboratory environment, but really safe in the sense that, that you're taking care of the kinds of interpersonal conflicts that we see reported. There was an interesting Wall Street Journal survey, I believe it was, fairly recently about bullying in the laboratory space. It's more common than you would expect. We see it actually in all, in a lot of frontline healthcare positions, but, making sure that you're taking steps to make it easy for employees to report issues of harassment or bullying in the workplace, and that they feel supported in that. And then, of course, reasonable goals and expectations for your staff, especially if you're in an environment where you do not have optimal staffing levels, ensuring that does not simply trickle down to your current staff to where they're feeling overworked, and to make sure that you're finding creative ways to keep goals reasonable is going to go a long way to making sure that your morale stays as high as possible. Couple other things I want to emphasize, and I don't know what the kind of constituency is listening to this call. I think it's going to get shared quite a bit and recording. The C-suite and administration is also responsible for playing a vital role in retention and morale. The joke is always, right, whenever we need people to work harder or feel better about the job, we throw a pizza party. I think most folks at this point know pizza parties are nice. I'm never going to turn one down, but that they're not necessarily going to drive morale in the long term. There's really three things that we see labs that don't struggle with retention do consistently, and that is really take seriously compensation. We say cash talks, right? Whether that is some sort of bonus tied to performance, whether it is call it generous raises when it's time to adjust for cost of living, or just making sure that when you're recruiting, you're bringing people in at a wage level that you can continuously, hopefully move up over time, and that makes people feel valued in the role you're bringing them into. I think that's the number one thing laboratories can do to make people feel appreciated. The second thing is time off and strong benefits. We always encourage folks to take a look at their benefits and time off policies, making sure they're competitive. And then fostering, as I just mentioned in the last slide, career development and culture. My biggest thing here, the biggest thing I see and try to talk to labs about hiring managers and decision makers, is to avoid being penny wise and pound foolish when it comes to compensation. I'll often see, it's a common thing for us to kind of get involved in negotiations between laboratory techs, bench staff managers, and hiring managers. and the kind of, I call it haggling between $1 or $2 in shift differential or in hourly wage. I understand laboratories are trying to control costs, and I understand today with reimbursement rates, margins are more important than ever. What you want to make sure that you're doing is not just laying down arbitrary markers, but really thinking about what you can afford to pay and how paying at or at that optimal level is going to allow you to retain that staff over time. And frankly, paying an extra $1,000, $2,000, even $5,000 a year may save you a lot in the long run, because you're not going to have unfilled jobs or have to be constantly replacing staff who are going to go elsewhere for more competitive salaries. Really briefly, because I've only got about 3 minutes here, I do want to touch upon something for the candidates who may be on the call. If you're somebody who's considering looking for a new role potentially in the next, say, 3 to 6 months, there are some really key steps I would take. And I would encourage you as well to reach out to Lighthouse for some of these. We can help you go over how to apply, when to do it, how to approach the process. We can help you with interview prep, providing tips as well as strategies for following up, and then also negotiating salary expectations, talking to folks about it, as I mentioned, the averages we see across the board, and having honest conversations about what reasonable compensation looks for a particular position, for a particular shift, particular geography, to make sure that on one hand you're earning your value when you take a new position, but that your goals are also reasonable for what folks in the industry are offering, because there kind of has to be a meeting of the mind when it comes to employee-employer for that match to happen and for you to get that traction in your job search. Want to wrap things up here in conclusion, just to say that we are so pleased here at Lighthouse to see an improvement in overall morale from 2023 to 2024, alongside an increase in compensation across the board. We do want to note, obviously, those pay increases have remained fairly modest and have a limited corresponding impact on retention, although there is certainly an impact, and certainly compensation is something that you should look at if retention is an issue in your lab. Beyond compensation, looking at making sure that you're adequately staffed through some of the retention tips that we spoke about, taking safety again seriously, taking appreciation seriously, and showing that appreciation rather than just letting people know they're appreciated. What are some things we can do to show our appreciation? Clear career advancement and training opportunities, investment in skill development, and engagement of employees, solicitation of feedback to make sure employees feel safe, feel appreciated, and feel well compensated in their role. We feel, again, that the across the industry, beyond efforts within individual laboratories, we need the industry to place in intensified or more consistent focus on recruitment and pipeline fortification to address longstanding staffing challenges. We need you, whether you're here on a call as a hiring manager or as a frontline laboratory professional, to advocate for training programs, for degree programs, for the kinds of efforts that are going to make sure that the supply of laboratory professionals remains strong in the coming years. So with that, I'm going to turn things back over to Alex, and I thank you for your time and attention today. We're going to hear some really interesting things from HC1.
Yeah, thank you so much, Joe, for sharing your insights, and Patty as well. That was great stuff. Always fun to dive into that report and see what the results are showing each year. Really quick, I want to pass things over for the remainder of our time to John Moyer, Senior Product Director with HC1. He's going to talk a little bit about, we hammered home how important hiring is, retention. But what if it's not necessarily in the budget right away to just go and hire for a role? He's going to talk a bit about HC1's workforce optimization tool that helps inform those decisions. So, John, I'll turn it over to you.
Yeah, great. Thank you. Can you just making sure sounds still good here, Alex?
Everything sounds good, looks good. Go ahead.
Wonderful. All right, we'll take it away. Well, yeah, thank you for having me, and thank you to my colleagues, Joe and Patty, for their walkthrough, really insightful information regarding staffing. And a little bit about myself and our company here. Again, my name is John Moyer. I'm the Senior Product Director at HC1. We're a healthcare technology company based in Indianapolis, Indiana, and we've been working with labs and hospital labs for over a decade on a different number of initiatives. And staffing is really near and dear to my heart. I came from 3 different labs, and gosh, times have changed, right? If anyone has been in the lab more than 10, 15 years, we really had to adapt as we move forward here, kind of pre-pandemic, through the pandemic, and post. So it's always really good to get these studies and get feedback and try to constantly evolve and improve the lab. So what we do, we've been partnering with some of our customers over the years, looking at staffing in a number of different ways. And I'm sure many of you on the call have had experience with, looking at productivity measures and billable hours, billable tests, right? And that was a lot of the measures and gauging of staff. How are we doing on a staffing perspective, years past? Well, certainly, as my colleagues had addressed, there's still a lot to do, a lot of work that we can improve here. And we came out of the idea during the pandemic at our company, hearing from our customers that saying, hey, gosh, it's really difficult to find a good techs these days. There's fewer that are graduating with degrees from universities, and retaining and making sure staff are happy just is the challenge we're facing. And so we want to meet them where they're at. And certainly companies like Lighthouse Labs and others are doing great work here. But we want to say, how can we bring technology to bear to maybe also look at the solution to determine, put some science behind the problem that we might have. So we came up with a product that we recently launched end of last year called HC1 Workforce Optimization, with the impetus of really trying to say, it'd be nice to be able to detect a staffing issue or potentially a shortage, or a shift level, maybe gap, that we have an opportunity to optimize before it becomes a problem. Right, maybe even getting ahead of listing a position or hiring or promoting people, understanding what is our current state and what does it look like in the future. So with HC1 Workforce Optimization, we basically connect to all of our customers' LIS and EMR systems to get the lab volume data, right? Number of specimens, number of tests, number of panels being run by individual department, typical LIS, EMR stuff, right? That's been our bread and butter at our company for many years. And combining that with the staffing data from like an ADP, Kronos, Workday, or other staffing system that basically is going to have that staffing schedule, hours worked, clock in, clock out. And if we can combine that information, then the goal is, we can really be proactive by detecting what is our throughput and what do we need from a staffing perspective for each department in our single core lab or multiple labs across our ecosystem. So really with this product, which I'm going to do a brief kind of just high level walkthrough today about how we can, merge technology and people to work smarter and not harder here by looking at, predicting future volume trends, identifying potential staffing problems. And what's also unique about our product and solution we've come up with is it is using some AI and machine learning I'll talk about to actually make recommendations as far as what you should do within your laboratory. So with that, we'll go ahead and move forward here a little bit to do a quick, how does this work exactly for those of you that are wondering? And as I mentioned before here, really all it takes is a basic connection, which again, we have our own integration engine, HC1 Connect, that basically brings in that laboratory volume feed. We can identify number of tests, number of panels, specimens by individual department. So we know exactly what's happening in real time in the laboratory. And then that HR system providing the staffing roster, who's scheduled in what departments when, are they cross-certified, that kind of information. We blend that together to put it in our HC1 platform. And this is where we use what I like to call human-assisted AI. AI is a buzzword. People talk about it a lot, but they don't ever explain really how it works. And so all it's really doing is an ARIMA model that's essentially looking at what has the lab volume been in the past, and you can put a capacity benchmark saying, this is what we typically do in this department across every department in the lab. So we know what is an expected level of throughput. And then looking at historical trends, right? Because you have seasonality in the lab. You could have different trends in different departments depending on time of year, like flu season or allergy season, or you know spin up a new new customer and you're getting a lot more volume coming in the door. And essentially looking at that and saying, okay, if we know what capacity is and we know what the history has shown us, and we know what people are scheduled where in the future, that's where we can actually make some recommendations as far as are we understaffed or overstaffed in any way that we need to shift or hire up appropriately. So with HC1 workforce optimization, our product really just sits as a very complementary component and product solution for our customers, LIS and EMRs, where they can manage this and accept or decline recommendations depending on their needs, and then be able to actually take action and being proactive versus reactive to some of those staffing optimization concerns they might have. So the first step, as Joe and Patty really articulated, is data and good data, right? So I mentioned connecting to these data sources is going to give us some really interesting key performance indicators. So this is where everything like you might see some very common metrics that you all are very used to talking about in the laboratory. So things like the average labor cost per test, the average test per FTE hour, how much is it costing us to run our lab on a daily basis. And so those are important trends to look at. Are we improving or not improving with that? And then what is our percentage of optimization? And then, you know, a lot of staffing systems, sure, you can look at a lot of that, but then showing that against the lab data, like what is our turnaround time? What is our productivity? If you filter by one department, you know, you can really isolate this and understand how immunology is doing to anatomic pathology, to cytology, to micro, and really kind of do some checks right across your lab. You might have a holistic, you know, vibe check, as it were, as a lab director. I was in that position for a while, and I kind of sensed, you know, where we had some challenges with accessioning and volume spikes throughout the day, and where you know people are happy or not happy. But I wanted really good data to back that up. So that's where we have, you know, our service level impact and overtime impact is really looking at productivity. You know, you want to be close to 100% capacity as possible. So anything below or above that line is an opportunity for improvement. And then even if everything looks okay, people still might be logging overtime to stay late, you know, to get results, to get accessions processed and specimens resulted out by, you know, 7 a.m. the next day, what have you. So first step is data. So this little dashboard here is part of workforce optimization to provide just give me the need to know information and are we improving, you know, over time. And I think that information is very powerful in the lab, so you can have informed decisions, you know, versus just hearsay from employees. That's still very important, but I think certainly the raw numbers are going to be very, very important to make those as a decision maker in the lab. Now, here's the unique thing. Many of you might be already do a lot of productivity measures. I think we have analytics, and you know we heard from our customers as well. Said, hey, how can we improve on that? And that's where the machine learning and new technology can come into play here. And the human-assisted AI is able to look at, okay, so if we know what your capacity's been, and you know these, we can basically look at staffing levels. So green here is an indication that hey, you're optimal on these days. We had one day where we were a little off, we were understaffed. Maybe a big volume spike came in, and we didn't have the capacity to handle that. Maybe someone called in sick and we didn't cover that shift. So that'll get detected, but I'll also look into the future and look for, you can see blue is understaffing and orange is overstaffing potentially. And maybe that's not a matter of, you know, hey, we need to reduce headcount. That's usually rare, but it may be that, hey, we need to shift someone's shift, as it were, from a morning to an afternoon in a particular department because that's where the balance or the imbalance has been detected. And that's really, really important. Everything, we have a lot of customers that are independent commercial reference labs, a lot of hospital labs, obviously have different needs there. But that's going to drive those specific department level recommendations I talked about where, hey, if we detect an area of, hey, you should, you know, add an FTE for this day on the schedule in the future, because based on your volume continually increasing, we don't see a change in the staffing that's scheduled out for that day into the future. And we can predict up to 6 weeks rolling, which is actually really effective. You know, you obviously might schedule in perpetuity end of year, but you're really going to manage people's schedules 2 to 3, 4 weeks out, be able to have that visibility. So here's where I said, you know, taking immediate action. So it's one thing to report the news, which is what analytics does, but it's another thing entirely to make the news, right? To be able to say, okay, let's make this change. I'm going to look at this recommendation, drill into the details, see who's scheduled when. We have one day that we're understaffed, and now what am I going to do about it? Am I going to accept this recommendation and make that update to our staffing schedule? Am I going to decline it because maybe I don't have anyone to schedule over that? You can make that decision, and this constantly trains the model, which anytime you're using technology, you want it to get smarter and make better and more tailored recommendations. And so that's really what you're doing here. And then lastly, monitoring how we're doing over time. So understanding how we're optimized over the long haul and how is that saving us money, right? From a laboratory spend perspective, you obviously, want to be able to hire smarter, be able to provide good compensation and salaries, but maybe it's just a matter of ensuring you're shifting everything appropriately so you have the right staff at the right department throughout the day to cover the volume that's coming in. And this is going to monitor those KPIs over time and really line up, hey, those recommendations that we provided, if we accepted them, did that in fact reduce our cost, for that week over time? And so I think that's really important because if without monitoring and looking back retrospectively, you have to be able to do that as you continually improve, looking into the future as well. So with that, I will wrap up and turn it back over to Alex for any questions.
Thank you, John. I think we're actually bumping up right against the top of the hour here, and I don't see any outstanding questions. So we're going to go ahead and wrap things up. I don't know if everyone saw it, but HC1 is offering a free 1-hour workforce optimization consultation for attending the call today. I pushed that form out while John is speaking, but there it is again. Go ahead and open that up if you'd like to take advantage of that offer, and they will be in touch with you soon. Additionally, if you'd like to follow up with Lighthouse Lab Services, if you're a candidate seeking job placement or an employer looking to help with staffing, we can assist you, and go ahead and use the Lighthouse form or email us at our info@lighthouselabservices.com address. Just want to say thank you again to Joe, Patty, and John for sharing their expertise and insights today. And I hope you all can join us again when we dive into this topic next year. Thanks, everyone.